Hey guys, how's it going? So, the last video I posted about borderline personality disorder has been discussing why borderline personality disorder happens in the first place. And I posted the video on Reddit and I found out that it had more than 10 views on Reddit, and I actually got a comment on the video saying thank you and a subscriber. So that led me to the idea that hey, maybe there is a person who is actually benefiting from these videos. And that means a lot to me. That means that I'm able to convey help through these videos in the form of explanations, in the forms of gaining a certain insight into the condition, and that for me means the world. That's why I decided to go on with making these videos. So this would be the second video in the series, and in this video I want to discuss how borderline personality disorder manifests itself in the clinical presentation and how it shows on a person and what is what, because frankly speaking, it's a bit of a challenge to understand the situation and the condition itself, even for a medical practitioner. So in medicine, when we study psychiatry as medical students, which I have done, it's not easy to comprehend the condition because the condition is so similar to many other conditions, so you don't really know what distinguishes this situation. So when you start to read the Diagnostic Manual, the Diagnostic Manual for Statistics and Diagnosis of Mental Disorders, which is the holy grail for psychiatrists in terms of reaching certain diagnosis. So if you don't know this, you have something called the DCM. This is the Diagnostic Manual. And the Diagnostic Manual is the manual that is referred to from psychiatrists, practitioners, when they want to make a diagnosis. So they want to diagnose you with something, they have to see that you fit the criteria listed in the DCM, and then they give you the diagnosis. Now they do this because this allows them to practice psychiatry on a professional scale, because you don't want to depend on your own personal analysis of the person. No, I see that, I think you're sad, I think you're overly angry. You know what, you have to improve your social. It doesn't work that way. You have to have a certain structure, a certain system in how to observe symptoms and how to cast a diagnosis based on these observations. And that's why you have the Diagnostic Manual, which aims to organize everything. And medical staff, professional staff, have to know this manual so they can understand the criteria, so they can, in the end, cast a diagnosis that is accurate, that follows a system. This is to also protect the psychiatrist from any kind of malpractice because he follows protocol, and at the same time the kind of information that you find in the DSM is actually extremely valuable. It is unbelievably valuable. It's based on a lot of statistics and a lot of gathered information over a period of 50 years that has been condensed and combined into a single manual, and that gives you a really good idea about the situation. Now sometimes, however, even for professionals, it's hard to understand what these criteria or the information that you find in the DSM actually mean. And for that, yes, I know, you attend lectures, you go to more experienced practitioners and you ask them, what does this mean, what does that mean? But generally speaking, as a med student who's not specializing in psychiatry, I would relate this to my peers and to my friends. None of them know anything about this condition because it's so vaguely explained. There's nothing really specific about these criteria. And that's the difference. It's different than, for example, bipolar or schizophrenia or depression. There's always one hallmark symptom that they refer to. In bipolar, it's the up and down of the mood swings, right? And in schizophrenia, you have this constant idea that the person is somewhat, hallucinating or has some kind of stimulus that other people don't have. And depression, of course, we all know depression. So these kinds of hallmark symptoms exist, but in borderline it's hard to pinpoint what exactly is the hallmark symptom. So here in this situation here, you have the diagnostic criteria, and you need to have at least 5 of these criteria present in order to make a diagnosis. So if you have just 4, you cannot do a diagnosis on a professional scale. You need to have 5 to have the diagnosis present. Now, if you don't reach the diagnosis, it does not mean that you don't treat the patient. No, you still keep on treating him, but the person cannot be diagnosed with borderline. Now, is it beneficial not to be diagnosed with this? Well, yeah, to some extent it is beneficial not to be diagnosed. So if the diagnosis is not be able to be reached and you're not diagnosed, so you're disease-free, that is beneficial for you in the sense of, for example, certain kinds of work that require a background check on certain medical histories and medical records. And if they see that you have borderline, they might exclude you from the kind of work that you're applying for. This doesn't apply to every kind of work, and some countries have certain rules regarding medical backgrounds and how much work providers are allowed to actually access from this. There's some kind of regulations that lowers this kind of access down, so you don't have a certain way of discriminating certain applicants. But it still is there, and it's not really good to have this diagnosis on your sheet. And that's why if you go to a psychiatrist and the psychiatrist says, well, I couldn't manage to really diagnose you because you have like 4 out of 5, 4 out of 9, that's actually a good thing. It means your record is clear. But you still have the indicators that you have it, and you keep on management and treatment as if you do have it. And that is, so you take the benefit from therapy, but you take also the benefit from not being labeled with this condition. Now, sometimes it's good to be labeled with this condition, especially legally. Now, if you're really troublesome and problematic, and this condition is manifesting itself really badly, you can have lots of you have a higher probability for crime, not because you have the condition, but because this readiness for crime exists, and it's fortified and strengthened by the condition. So in this situation, having this condition on paper protects you to an extent legally from the crimes that you commit. And it sounds bad, I know, but it is the truth. You have a condition. You cannot deny that. You see? So that's regarding the diagnosis and whether it's good or not to have the diagnosis. Now, what I want to explain in this video is trying to make a hallmark, or the kind of stigma or stereotype for borderline personality disorder that gives you a clear idea of what it is. So once you hear this term, you know exactly what it means. And I want to read these criteria for you and try to explain them for you in a way that gives you a clear understanding and a clear idea, because that not just helps you understand the condition, but it also helps you understand and reach insight. Now, the importance of insight is of tremendous importance, but I'm not going to go through this in this video. I'm going to go through it in next videos. But insight is the most important thing that you have to reach in borderline. I'll come to that later. So if we go here and read the diagnostic criteria, we go here and read, for example, frantic efforts to avoid real or imagined abandonment. So we have, this is a keyword. Do not include suicidal or mutilating behavior, because this is a criteria by itself. A pattern of unstable and intense interpersonal relationships. Unstable relationships. Identity disturbance. Markedly persistently unstable self-image or sense of self. Substance abuse. Reckless driving. Impulsivity. So that's number 4. Potential self-harm. Recurrent suicidal behavior. Affective stability due to marked reactivity of mood, intense episodic dysphoria, irritability, anxiety, usually lasting 4 hours, chronic feelings of emptiness, inappropriate intense anger, transient stress-related paranoid ideation, or severe dissociated symptoms. Okay, so you might have noticed that these symptoms that I've just read are not really specific for anything. So if you want to talk about fear of abandonment, I've seen that in many kinds of people. I've seen that in depressive people. I've seen that in children who had trauma. I've seen that in people who had some kind of accidents later in life and they lost their loved ones. So they have a frantic fear of this kind of abandonment. Now, unstable personal relationships. I see this in schizophrenia too. This is not just in borderline, right? So schizophrenics have unstable relationships. It's not just specific to this condition. Identity disturbance. Again, you see this in other psychiatric conditions as well. Impulsivity. Well, there are lots of other conditions as well in which you have impulsivity, so this is also not specific for the condition. Suicidal behavior, very high in depression. Chronic feelings of emptiness, also depression. Bipolar, suicidal behavior too. Intense temper, and inappropriate anger, and affective instability. So affective instability and inappropriate intense anger are actually quite related to each other. So this and this is related, but I'll have to delete the blue marking because it's starting to overshadow the words. So affective instability, marked by reactivity of mood and intense anger, is a result of this and this. But I'll tell you why these two are separated in the manual and why they're not in one single sentence. The transient stress-related paranoid ideation or severe dissociation. Now, this is a rare clinical symptom that happens to people with borderline. It's not that common, and this, I think, is just included because it's a sort of way how to, So if you're writing down the diagnostic manual, if you're like a group of psychiatrists and you have research of the last 50 years, you want to come down and make a set of criteria, and you find that this kind of symptom is prevalent in borderline, and this is different than all the ones previously mentioned. Why? Because this is actually a disturbance in how you perceive reality. So this is more going down the line of schizophrenia than it is going down the line of having a simple disturbance of mood. So this might be the most severe symptom that you could get in borderline, and that's why it was important to include it, because you have to protect yourself as the one who's writing down the diagnostic manual. You have to be fair, and you have to include all the outcome of the research that you've gathered. And if this is a symptom that happened in a number of people who are diagnosed, you have to include it. But I can tell you that this is not a hallmark of the condition, and it's not typical for borderline, and it's not really that prevalent in borderline. It's not that much to have dissociative symptoms or these kind of paranoid ideations. It's not really a common thing. And I say this, it's different than having paranoid ideas than transient stress-related paranoid. So that's different. So the difference between being normally paranoid and between being transiently stress-related paranoid is that the second condition, which is a transient-related paranoid ideation, is a certain condition in which you go through high amounts of stress and then suddenly you go dissociative and you're not yourself anymore. That's different than being just a paranoid person. So I'll explain to you in this video, and this actually might become into a long video because there's just so much explaining to do. How to understand these non-specific behaviors and symptoms and cast them on borderline, and understand that these apply on borderline disorder and why they were mentioned. So, the frantic efforts to avoid real or imagined abandonment. This is not the result of a certain trauma. This is not the result of something that happens in your life and then you try to avoid it, like for example an accident or whatsoever. So let me rephrase this. This is a restructure of thoughts. And this sounds a bit complicated, but it is more simple than you think. So there is the preconception that you're going to get abandoned. So this preconception, abandonment. So you have this as a conviction. You're convinced that this is going to happen. You're convinced that this year is going to happen. And then you take certain behavioral actions to avoid it. And the problem is that the behavior you do to avoid abandonment is the kind of behavior that is not good. So some people decide to end a relationship because they're afraid of being abandoned at one point. They are convinced that at one point their partner is going to lose interest and they're going to get hurt. So they decide that, hey, I'm going to end the relationship right now before that happens because I see indicators of abandonment. Now, of course, that is an extreme kind of behavior. That is not a normal behavior. And that is what is meant by frantic efforts to avoid real or imagined abandonment. It means that the preconception, the conviction that you are going to be abandoned for sure is present, and it is there. That's what's meant with this sentence, so you understand what's going on. A pattern of unstable, intense interpersonal relationships, identity disturbance, impulsivity. As I said, intense interpersonal relationships and unstable relationships is something that happens in more than one clinical condition, but what is meant here in specific is this here: evaluation, overvaluation, and devaluation or hypervaluation. So that is what's meant with unstable relationships. That means that if for example, you're in a relationship with someone, right? And you have these two as the indicator for yourself in the relationship. This is you. You're either happy or you're sad. Now, sometimes you're in a relationship in which during the relationship you see happy things about your partner, especially when it's the beginning of the relationship and you go through the infatuation and the hormonal effect of hormones on your brain and how love happens chemically. You have a lot of positive things that you see from your partner. Now, with time, unfortunately, these hormones and the whole chemical process of love declines, and then you start to see more negative things about your partner. And there's a system here. The system is that whenever you see something positive, it's overrated. So you become overly happy about something good that you see, and you become overly sad and overly upset about bad things that you see. So this is what's meant with overvaluation and devaluation. It's that when you see something good from your partner, you're overly happy. And when you see something bad from your partner, you get overly discouraged and you hate the partner because of these bad things. For example, if you're a guy and you're with a relationship with a girl, and someday she doesn't dress up the way you want, or she doesn't put effort into herself, that becomes a big deal for you. You cannot control how the emotion is exaggerated in your brain. And remember what I said in the first video, the amygdala, which is responsible for emotional control in your brain, is hyperreactive. So whatever stimulus comes inside here comes out as an exaggerated emotion. So if that stimulus is, for example, something bad from your partner and goes inside your brain and gets processed through the amygdala, it comes out as an hyperstimulated form of emotion and behavior that is negative, that is not good. And that's what's meant with unstable relationships. You are suffering and you are a victim of having this. The constant overrating and the constant being happy about good things and being sad about bad things. Now, this is not the case in normal people. Why is it not the case in normal people? I'll tell you why. In normal people, they have the ability to cancel out certain things. So they have the ability to say, okay, but this overrides this. You know? Okay, maybe she didn't look good today, but I have pictures from her in another day when she looked really good, so I can open up the pictures and look at the pictures and hey, I'm a happy man again. So this overrides that, right? Oh, my husband is not working, he's lazy today, so that's a hugely negative thing. But at the same time, I remember that he's so hardworking, he has a job and he pays everything and all the expenses, so this overrides that. That is not, this kind of overriding is not present in borderline. They don't have it. They have it, but it's not really strong. Why? Because the emotion itself is stronger. That comes out of the amygdala is stronger. And that's what's meant with the second sentence of pattern of unstable, intense interpersonal relationships. Identity disturbance, marked and persistently unstable self-image or sense of self. Now again, this is a very broad sentence that does not really seem understandable from the first time you read it. But what is meant with this is something called a chameleon behavior. So this is something that is present in borderline. They have the ability to adapt, to change their personality depending on who the person is they deal with. So they have personality A, B, C, D. So their personality changes according to who they deal with. Now the problem is that this is actually normal. This happens with most people. So if you analyze the behavior of any person, you notice that people change their behavior based on who they're with and when, at what time, and how many people are around them. So all these things affect how they change their personality. Now in borderline, their own self-perception of this change is high. So one day if I, for example, treat person, for example, Michael, I treat Michael differently than I treat Jack, right? For me, as a borderline person, I realized that, oh shit, I exerted personality A and I exerted personality B. That means, who am I? It means I don't have a personality, because everything in the brain of a borderline person is overly exaggerated. So the person has realized that he had exhibited two kinds of behavior A and behavior B. And this perception that is in between here, that there is a disparity or a change in these two kinds of behaviors, resulted in an over exaggeration or an anxiety of this kind of perception. So let me write this down to make it clear. You have a perception of self-change behavior, which is normal. But for a borderline, this is a cause of anxiety for the borderline person. It's not like a thing of, hey, I do this because that person is different. No. This causes a great sense of instability for the borderline person, because the borderline person now thinks that he does not have a constant core of personality that is present. So the fear that comes out of this is high. And that's why you say unstable self-image. So as you can see from the sentence, this is a subjective sentence. This is not a sentence that the psychiatrist is able to see from you within. This is a sentence that is based on what you tell the psychiatrist. He says, okay, that is a common example of having an identity disturbance or an unstable self-image. And one example is, for example, people who have borderline come up with ideas of they don't know what job or what career to do, because they can imagine themselves in everything and at the same time at nothing. So then the psychiatrist says, okay, you have it as identity disturbance. It's not because the psychiatrist was able to penetrate your thoughts and to see it. No, this is the kind of information that you give him based on the turmoil that happens in your brain because of your over fear of not having a core personality, because you realize that your personality is changing. Right? Now this also affects confidence. Now this anxiety causes low confidence. And low confidence is another cause of concern for males, because males have a big issue with confidence. So if you're a woman and if you're watching this, you might not be aware of it, but males have a big paranoia concerning confidence. And this is not just for borderlines, this is for any kind of male. They have it from early on in their childhood. They have the idea that they have to be confident. If they're not confident, you're not going to get the girls. People are going to realize that you're not confident, and that's not going to be good for you. You're going to be a wuss. You're going to be a weakling. So this is a big issue for boys. And if boys suffer from borderline and they go through the realization that, hey, I don't have confidence in myself because I realize that I exert different behaviors in different situations, that causes them a great deal of internal struggle. Now, a result of this is a rigid personality. And this is something new that I don't really find oftenly explained, that the boys who try, or the males who try to compensate, and I don't know if this applies on women, but I think it applies more on males, if they try to compensate the fact that they act like a chameleon, which is actually normal, but they don't think it's normal, when they try to compensate this, they turn into a rigid personality. So they try to do things in a very rigid and formal way, and they try to treat all people in the same way, and they start to have these ideas about being fair with everyone and having the same kind of treatment for everyone, and it makes their personalities odd. It makes them odd. So this is one perception that makes other people perceive you as odd, strange, because you have the same level of strictness, you have the same level of professionalism when you deal with people. You don't have the level of love. For example, if you deal with friends, you're not going to be a loving or caring person. Why? Because your baseline core personality that you're trying to adapt to avoid this chameleon behavior is more likely to be a professional personality. It's more likely going to be a professional personality than a loving personality. Why? Because you deal more with people in a professional environment than you deal with friends and family. So you want to adapt your personality not to be a chameleon, and you draw a baseline based on professionality because obviously you deal with more people at work and school, so you want to be professional. Now the problem is that this emphasizes itself on your relationships with your family and your parents and your loved ones and whatsoever. Not a huge impact. Impulsivity, an affective instability, and rage, inappropriate intense anger. Now these three, number 4, number 8, and number 6, are all related, and these are very strong manifestations of the amygdala that I've explained to you in the previous video, which is the amygdala having the kind of over response and overstimulation here. These three are a core example, and they have been divided into 3 different kinds because of the importance of each of these symptoms. So because the over-exaggeration of the amygdala can manifest itself in any kind of emotion, the most 3 important emotions that affect you as a person with borderline are these 3. It's the rage, it's the impulsivity, and it's the affective instability. The rage and the impulsivity affect you because these can cause you to harm. More self-harm than harm on other people. So you end up throwing something against the wall in your room. If you're alone, you end up hitting your fist against the wall. You end up self-damaging. Intense anger, impulsivity, reckless driving, sexual. Now the sex here is being added into the impulsivity, but it actually goes into the intense interpersonal relationships. So that is, I would say that is a mistake. You should not add the sex on the impulsivity. Now why? Because this is a result of this. Because you have a constant up and down of people, you try to follow this year. You try to avoid this year. So whenever you find a person who has something good, you try to stick with that person. And then you find another person who has something good, you stick with that person. And then you find another person who has something good, you try to stick with that person, but you don't realize that all of them have bad things as well. So these bad things cause you to jump to the other person. And then you go to the other person, he has something good, or she, and then you realize they have something bad, and then you jump to the other person, and so on and so forth, and this is called promiscuous sexual activity. And this is not a result of impulsivity, this is a result of the intense interpersonal relationships, unstable relationships. You see? So impulsivity and the over-exaggeration of the emotions that you feel from the amygdala, they are highly related. You want to go through a rush, through a thrill. This is all because you have the emotion of wanting to go through something exciting. The affective instability, the reactive mood, intense episodic dysphoria, instability usually lasting hours and only rarely more than a few days. This is because they want to differentiate between you and bipolar. So in bipolar, the range of days is more. It's not just a few days, it's not just a few hours or rarely a few days. No, in bipolar it goes more than a few days until you change your mood. So they added this so they can differentiate between you and between other conditions. So this is, recapping the video, it looks quite complicated, and it's a kind of dissection of these 9 sentences and what they mean. and how they are interpreted and how you can interpret them and understand them in a better way. Now, what I want you to understand from all of this comes down to one idea: overstimulation of emotion, amygdala, hype. I want you to understand this. I want you to put this core idea into your brain, and together with the dissection and explaining I did on the last 9 points, I want you to shed the light of this core idea on these 9 sentences. And I want you to ask yourself if these 9 criteria can be explained from the hyperstimulation of emotion. And if the answer is a yes, then you will be coming out of this video with a core understanding and idea of what borderline is. Just like you have an idea of what schizophrenia and depression and bipolar is, now you have an idea of what borderline is. It's an hyperstimulation, overstimulation of emotion. And that explains to you all these 9 criteria. So instead of trying to focus on any of these 9 criteria as a hallmark for borderline, no. You read this core idea, core principle, and you shed the light of this principle on the criteria that you read in the Diagnostic Manual, because they can all be explained with this. And guys, thanks for having watched the video. It's been a long video. It's been 31 minutes now, but I think these topics are really complex and they have to be dedicated in these kinds of minutes. I could try to make them shorter in the future, but for the start, I'm just going to keep it this way. I really do hope you benefited from this. Thanks for watching. Thanks for listening, guys.